Hello, everybody. As our mentor, Dr. Aitar, just said, our group is communicating the connection between climate change, human health, and sustainability in New Hampshire. So climate change is here, and it's affecting our public health, but not everybody knows how climate change can affect their health personally or the health of their community. And this is preventing New Hampshire from taking steps to mitigate and adapt to these climate changes. So how are we going to get this information out there? Well, public health care workers are a very qualified group to deliver this information to the public. They interact with the public about their health and are very trusted by the community. Work educating healthcare workers on the impacts of climate change has already been done. In 2014, our very own Sustainability Institute published an assessment of the health impacts of climate change. And the goal of our project is to continue that assessment with things that have been published since 2014 and take it a step further and do some research about interventions that can be done. And we will be delivering this information in the form of an annotated bibliography and a literature review to this really cool grassroots organization, the New Hampshire Healthcare Workers for Climate Action.
So as Justine was saying, sometimes it can be a little bit difficult for people to understand the exact ways in which climate change is impacting human health. So the CDC has developed this framework, the Building Resilience Against Climate Effects, or BRACE framework, to help understand that. It's a 5-step iterative process that begins with forecasting climate impacts, moves on to how human health will be impacted by those, assessing public health interventions, developing and actually implementing those interventions, and then finally evaluation of intervention outcomes. Out of the BRACE framework, the CDC has identified 8 key indicators by which climate change affects human health. And those are mental health, behavioral and chronic diseases, waterborne illness, foodborne illness, air pollution, extreme weather, heat stress, and vector-borne disease. These are some of the ways in which climate change is impacting these indicators. And to sum it up, they're all getting worse. Extreme weather events will be increasing. There will be an increase in air pollution, an increase in heat stress, increased transmission of vector, water, and foodborne illness, and exacerbated mental health and negative health behaviors. So moving forward, we wanted to give you this overview so that we could talk more about the interventions that are happening, knowing that this is all already happening in New Hampshire.
So our group implemented a variety of different methods to conduct all of our research. We started with a rapid review of existing literature on the topics. We also conducted a series of semi-structured interviews, and we reviewed a series of webinars put on by the New Hampshire Healthcare Workers for Climate Action. So starting with the rapid review process, this is a rigorous review process of existing literature, and we chose to use a rapid review process because it essentially simplifies the traditional approach by getting through a really wide range of sources in a short amount of time. In our case, we had over 250 sources, so this was really important for us to narrow down what exactly was most important for us. In doing so, we worked with our research librarian in order to construct a couple different search strings that narrowed down exactly what we were looking for, and they're located here, and kind of lay out all the different parameters that we kind of dug into. We used the PubMed database, the Web of Science, and then the National Institute of Environmental Health Services Climate Change and Human Health Literature portal. So this Prisma diagram is really just a visual representation of what I just explained. It shows the process of how we started with such a large amount of sources and how we narrowed them down into what was most eligible and appropriate for all of our research. The bottom 4 just shows what we found for each different health indicator.
We also conducted semi-structured interviews, which are a set of predetermined questions that guide the conversation while allowing for other discussions. So we met with 8 stakeholders, 1 for each indicator, and asked them 5 questions about their work, what they have seen with respect to the indicator, challenges in communicating the health effects of climate change, communicative tools that they think would be helpful, and priorities for the climate health movement.
So from our review, we can conclude that there will be increases in the frequency and severity of extreme weather events, most notably in increases in coastal and inland flooding, more severe ice storms, and a higher frequency of extreme precipitation events. New Hampshire is at a higher risk of coastal flooding because of rising ocean temperatures contributing to sea level rise, in addition to erosion of the coastline and higher frequency and severity of storms. Since the year 2000, tidal flooding has increased 260% on the New Hampshire coast. Extreme weather is a very broad name for many different climate conditions. Therefore, there is a lack in published literature connecting extreme weather directly to human health impacts. So some of the direct impacts include physical injuries, death, including drowning from floods, structural collapse of buildings and other infrastructure. And then some indirect health impacts include degradation of water quality from contaminated drinking water supplies, reduced nutritional status, and exposure to chemicals released by storage sites.
Moving on to air pollution. In the New England area, air quality has been characterized as sufficient or acceptable, which can be identified by the green and yellow markers on this map. But due to the increase in Atlantic Ocean temperatures, we are seeing suffering ozone, decreased air quality, and warmer days. We will see a 3,300 increase in deaths per year due to this warming. Moving on to PM 2.5 related exposure. PM 2.5 is particulate matter, which is caused by fossil fuel emissions, and when ingested can cause cardiac and respiratory issues. Respiratory risks are higher on warmer days, and cardiac risks are higher on cooler days in this area. These risks are higher in months of increased temperature variability. On this map, you can see red dots. This is where vulnerable populations are likely to have either short-term or long-term exposure to this harmful chemical. Vulnerable populations include pregnant women who are experiencing early pregnancies and complications with their pregnancies, children who are experiencing high asthma, respiratory illnesses, and atopy, and low-income communities are experiencing high ER visits related to cardiac and respiratory issues. Interventions include citizen scientist monitoring. So this summer in Manchester, there will be air quality monitoring in vulnerable locations, and fire permits in New Hampshire are increasing on a yearly basis.
So going along with extreme weather and air pollution, heat stress is another indicator that we looked at. And this graph on the board is from the 2014 impact report, and it shows the projection of hotter days in southern New Hampshire, and it's split up into lower emissions and higher emissions. And so, there is increased extreme heat in the Northeast, and this is specifically an issue because it worsens chronic conditions and negatively impacts a whole host of populations, such as children, elderly, pregnant women. And I think it's very important to note that the heat index has been changed from 95 to 85 degrees, and this is a point of emphasis because it shows that these are issues that are happening right now and today, and we can see those through the change in the heat index. So heat stress also affects vector-borne disease as the largest climate factors that affect the increase in vector-borne disease is temperature, precipitation, and humidity. The graph, again, on the right of the screen is courtesy of the CDC, shows the amount of Lyme disease specifically in the Northeast. And so we're seeing more tick species for longer seasons and more in more north regions. So there is risk of new pathogens interacting and a high risk of co-infection. And so there's a lot of susceptible populations, specifically outdoor workers, immunocompromised folks, elderly people, and this also has the ability to limit outdoor recreation amongst people in the Northeast.
So our climate is getting warmer and wetter in New England, and the warmer part means that pathogens are going to be able to grow more easily in the water, and the wetter part means they're going to be transmitted more easily. And this is going to affect our health everywhere where we interact with water: our drinking water, our lakes, and our oceans and our estuaries. And unfortunately, the normal sequence of events is somebody gets hospitalized from interacting with contaminated water, and then we go back and test it and go, oh, it was contaminated. So what we really need to do is test the water before it gets people sick. So the main intervention should be more frequent monitoring. There is monitoring in New Hampshire of cyanobacteria blooms with citizen science. Super cool. But I think citizen science can be expanded to monitoring other forms of pathogens in water. And I think it should just be talked about in the physician's office more regularly.
So for foodborne disease, climate change has increased instances of rapid food spoilage as a result of power outages from in the summer with increased AC use and from more frequent and stronger storms. And there are records of increased gastrointestinal illness during these power outages. And with each increase in degrees Celsius, there is an increase in hospitalizations for gastrointestinal illness. For intervention, about 60% of gastrointestinal infection in the US happens in restaurants, so some of what is happening is giving restaurant owners more guidance. The Biden administration and the Department of Energy are working to reimagine the energy grid to enhance resilience and efficiency, and also by encouraging sustainable agriculture practices, purchasing local food, and ensuring access to safe food for everyone in the state with tools like the New Hampshire Food Access.
So as the effects of climate change continue to increase, we're actually seeing that there is an increase in mental health and stress disorders. So our research showed that natural disasters and heat waves can actually cause this increase of mental health and stress disorders, as well as an increased rate of suicide and collective violence. So some notable interventions in New Hampshire include the creation of a brief guide to individual therapy for climate-related mental distress. This is the first climate resource for mental health practitioners, as well as an increasing availability of pre-disaster prevention-oriented planning and intervention planning. So the New Hampshire Healthcare Workers for Climate Action emphasize the importance of multi-sector approaches to promote mental well-being within New England.
And moving on to our last indicator that we looked at, health behavior and chronic disease. I think sometimes it can be a little bit difficult to understand why health behaviors are important. So to do that, I want to emphasize the 3-4-50 model. It says that 3 behaviors, tobacco use, poor diet, and sedentary lifestyle, contribute to 4 major diseases, which contribute to 50% of the deaths in the US. And climate change can impact any of these behaviors. For example, as our heats get warmer, as we heard earlier, the heat index has been decreased. So when people get to a certain heat index, people aren't going outside and aren't participating in physical activity as much. For diet, our climate impacts which food can be grown locally. And so as that changes, the food that people are consuming also changes. There's a few different interventions, but one that I want to focus on particularly for diet is the New Hampshire Food Support Hub. This is actually a larger part of the food access map that was recently discussed. And it includes information about federal food assistance programs, recipes, how to use different types of produce, so that when people are introduced to these new types of produce, they know how to use them so they can maintain a healthy diet.
Moving on to the gaps, a key takeaway of this project was finding gaps within our research. So starting with extreme weather, we found there was a lot of information on how much property damage is done by extreme weather, but not on how it impacts human health. Moving on to heat stress, more vulnerable groups need to be educated on how them specifically are impacted by heat stress. The relationship between declining ecosystems and public health need to be further explored in mental health, waterborne disease, and foodborne disease indicators. We need to have better predictions on how outdoor spaces for physical activity will be altered because of climate change. We need more data on how tobacco use changes impact our health behavior. We need better collaboration between states in surveillance and mitigation techniques of vector-borne diseases. We need to have better indicators of how climate change affects foodborne pathogens. And lastly, we need more monitoring of health impacts in areas with childcare facilities, animal agriculture production, and low-income communities. Moving forward, to continue our research, we will address the New Hampshire Healthcare Workers for Climate Action by giving them our research paper and giving them an interactive deliverable so that they can educate their patients and their coworkers. Our gaps will be addressed in the new impact assessment for climate change and New Hampshire human health. The ECHO project, which is happening at New Hampshire and Dartmouth-Hitchcock, addresses how climate change and human health are connected on a weekly basis. We have actually submitted a couple blogs to the New Hampshire Healthcare Workers for Climate Action on how we specifically have been impacted by climate change. And we have also been addressing the New Hampshire Climate Action, Healthcare Workers Climate Action in the webinars and in an interactive way. So these are all ways that we can get involved on a local basis. Thank you for listening, and we will take your questions.